And you are now live.
Thank you, Aisha. Welcome everyone to this evening's FBS Chat. We are really, really pleased to have Fredrike Bannink with us from Amsterdam. Welcome, Fredrike. And my two co-hosts, Gil from Columbus, Ohio, and Russ from Florida. So a truly international conference or conversation. So Fredrike, before we look at the work and your many, many books and articles, I always like to know about the guests and how they came across solution focused positive psychology. What was your first experience of it, and how it kind of changed the way you work?
Okay, thank you for asking this question. I think it was the early 90s, I guess, that somebody, a Dutch colleague, had just visited Milwaukee, Steve de Shazer and Inzu Kim Burke, and had done a training course with them. And he came back to the Netherlands, and he was very enthusiastic, and he decided to do a one-day workshop on solution-focused brief therapy. So I went to that workshop, and we had the same background. I'm a cognitive behavioral therapist. He was one. We both had a hypnosis background as well, medical hypnosis background. So we were, so to speak, working in the same direction, so to speak. So I went to this workshop, one-day workshop, and at the end of the workshop, I thought, wow, this is different. This is different from the way I used to work, because I had been in the business for quite a long time already, and really wasn't satisfied with the way things were going. In traditional CBT, cognitive behavioral therapy, problem-focused CBT, and found it rather boring as well. So, sometimes things just happen at the right time, and I think solution-focused brief therapy was one of those meetings in the right time, in the right place. So after that, I left that workshop enthusiastically. I thought I'm going to read about it. I'm going to try it out, and well, here I am.
Wow.
And I was lucky to meet Stephen Inzu a long time ago. I'm sure you did. Some of you did too, especially the older people. And I was very lucky that Inzu wrote the foreword for my 1001 Solution book, just a few months before she passed away. And that book was published in Dutch in 2006, and she died early 2007. And well, I feel very honored that I knew these people, and let's see what she actually wrote the foreword for the 1001 Solution Focused Question, which later on, I think 2010 was translated into English.
And when you said you went to the one-day conference and you thought, wow, what was the wow, Fredrike? Why did it wow you?
The wow was the wow of discovering that there is a more positive focus, I guess, in the way we work, whether it's psychotherapy, whether it's education, whether it's, I just wrote a book on optimal education, whether in my work as a lawyer, doing solution-focused conflict management, it's applicable everywhere, basically. Leadership, I wrote a book on solution-focused leadership. I wrote a book on hospitality. Mark McCurgo, I'm sure his ideas. So the wow is there is another paradigm possible. It's not the analytic paradigm, which we all know. You know the medical model, which I was brought up in, and probably you too. And there was the synthesis paradigm I discovered later on. And this is another paradigm, another way to make the world understandable from a how do you call it, a philosophy of science point of view. And that's not looking back at what's already there, but looking forward at what might be created. And it's more fun. I think my mission in life, and the reason I write all these books and do all these training courses and all these lectures all around the world, has to do with the fact that I'm not satisfied with the way things are going. I think things should have changed a long time ago. But of course it doesn't. It takes a long time. But then I think if we look at psychotherapy, for instance, I think it can be shorter, it can be better, it can be lighter tone, and it can be, and I think that's very important, more fun.
Fredrike, you said you went to the workshop, one-day training, and you had this wow moment, and then you went to try it out.
Sure.
What was your initial experience when you very first started trying being solution focused?
Oh, I don't remember. It's too long ago.
Make something up.
I'm talking about the early 90s. I don't know the first experience, but I discovered fairly soon that things could be different, and it requires a different mindset and a positive focus. And later on, the positive psychology came along, but that's later on. And of course, I'm familiar with Milton Erickson and his work in the 70s, and his because of the hypnosis background and his way of asking his patients, suppose I meet you in 6 months' time, and you're telling me that things are better, your life is better. What would you tell me? How would you describe your life? And what would you tell me? What obstacles did you meet? How did you overcome them? And then, as you probably know, he already discovered that when he met his patients again after this positive imagery, this is visualization, that things were actually better because he did it with hypnosis. But I guess you can also you can do this as well, of course, without the hypnosis. The description of a new and better life. Yeah. So I don't really remember one instance where I discovered how it was actually working, but it was more a realization that there's another mindset and there's another paradigm where you can work from. And I found it very appealing, and also because the tone is much lighter and the focus is more positive, of course.
Yeah. Well,
but then as a CBT therapist and trainer, and therapist as well, I sometimes say, I don't do that much therapy anymore, but I might say to my clients, so this is the problem you bring it to the table. Would you like to tackle it in a problem-focused or solution-focused way and give them the choice?
Mm-hmm.
Wow.
Yeah, that's another possibility, yeah. And what do you think most people choose then? What do you think?
Positive, focused.
Yeah, positive way.
Yeah.
Although there's one group of clients, and this might be diagnostically interesting as well, that sometimes say, well, let's do it in a problem-focused way. You know, which one those two are? Take a wild guess. What do you think?
Wow.
What was the question, Fredrike? Because I missed part of it.
Well, most people, when you give them the choice between, do you want to, tackle your problem, let's say tackle your problem in a problem-focused way or solution-focused way, and you explain just a little bit what you mean by that. What do most people choose? And then you said, well, most people chose a solution-focused way, and that's correct.
Mm-hmm.
But there's one group of clients who might choose the problem-focused route.
Well, Fredrike, I've got to be honest, I was kind of surprised by that answer.
Really?
Yeah, my experience has been that a lot of people are still stuck on the medical model, even clients. They believe that only through understanding their problems and issues
Sure.
and getting insights into that can they truly get to their, being on track. And so I'm kind of delighted to hear that people are choosing the solution focused over the problem centered, but I'm actually a little surprised.
Yeah. But well, you have to bring it in a rather juicy way, of course. But then,
Is that your
neutral? I bring it in a neutral way. But then, well, this group of clients that sometimes choose the problem-focused way is a group of clients that are not willing to change.
Yeah.
I had this psychiatrist here in Amsterdam, and he used to phone me, and he would say, "I've had this patient now for 5 years on the couch, and this person has all the insight he could ever want to have. Could you actually see if there's something that person would like to change?" Because, well, you might say to your husband or to your wife, "Yeah, darling, I'm in psychotherapy, for about 4 years already, but we're busy, we're working on it. So you don't need to change a thing, huh?"
Yeah, well, that makes a lot of sense. As I'm listening to you, by the way, I'm a super fan. I've loved your books and your videos, and
thank you.
Yeah, and really what I love about it is, unlike many other authors, I always consider brilliance to make complicated issues very simple and straightforward, clear and understandable, which is what you've done, very practical.
Thank you.
I work with people who like to take easy things and make them more complicated.
I know those people too.
As I'm listening to you, one of the things that I'm thinking about, I'm thinking about my students. I'm going to have them watch this. They're learning about the solution-focused model. I work with counseling graduate students in both clinical mental health and school counseling. And, I've got students who kind of latch on very quickly, like you and many of us. We were wowed by this. And then we have some students who just really are still very skeptical. And it takes a little bit more convincing and more examples through the assignments and having them experience it for themselves. They finally start to come around. By the way, some of the more reticent actually toward the end become some of the greatest supporters of this. But I'm listening. For you, the mindset was you wanted something better, something more effective, something more brief, something more light. And I think that's what kind of wowed me as well when I first looked at this, also in the early 90s. But what are some of the, for students who are still kind of skeptical, what would you say some of the other mindsets and behaviors are to move to the other side? So what makes someone more open to the solution-focused model as a practitioner? Maybe it's possibly letting go of some assumptions.
Yeah, sometimes you have to unlearn more from the medical model, especially the people who are working in the field for quite a long time already. Then you have to learn new things. Well, I give lots of training courses here in Holland for family doctors, for GPs. And, well, of course, they use the medical model, the analysis paradigm. Yeah, sure, the doctors. So, but then they are very pleased to notice that around 40% of patients who are sitting in the waiting room, in their waiting rooms, who are feeling depressed, who have anxiety disorders, who have, somatic complaints that nobody knows what's causing them. I forgot the English word for it, but anyway, about 40%. And they say then in those cases, the medical model isn't working because there's no use to send a patient to the fifth specialist or the sixth specialist, So I wrote a book about positive healthcare together with one of the GPs here in Holland, and we do many training courses. And for instance, he says to his patients, he says, you don't always have to know the cause of a disease to actually look at what is working. Is it okay if we talk a little bit? He always asks permission to his patients, always. Is it okay if we talk a little bit about what is working until now and what you can do more of? And then so he switches from the medical model to the synthesis paradigm, from the analytic paradigm to the synthesis paradigm. And he says, I've never met a patient who's not willing to do that.
Wow.
Asking permission first. And well, it's a very, very, very gentle way of inviting, let's say, the patient, his patients to look at what is working and their preferred future. Yeah. But then you know, I agree. Sometimes the most critical people become your greatest fans. So, you know, I once gave a training course, and one person at the end of day one said, "I think it's all a bit superficial." And I said, "You hit the nail on the head. That's what solution focus is about. It is superficial. You don't have to dig. You don't have to dig and find causes or whatever." So he was very pleased about that.
Yeah. So that's really kind of one of the critical misperceptions that maybe sometimes prevent people from engaging in this, which is, you know, you have to understand problems and issues first.
Yeah, sure.
What do you see as some of the other misperceptions or myths that some of us have kind of been able to dismiss, but others still kind of cling on to?
For instance, if we talk about PTSD, post-traumatic stress disorder, that it requires long-term treatment, in which people have to relive the traumas, and well, you know, when I was still a traditional CBT therapist, we went and we did EMDR, which I think is a great tool, by the way. But and you can easily combine it with solution focused work, I guess. But then we talked about everything that was going on, and we recorded it, and the people had to go home and listen again and again and again and again and again. And then I did so many trauma work that at one point, when my husband came home, he would, and I would be so irritated because these were all man-made disasters, so to speak. You know, all these traumas. So then I would take it out on him, and then
and you would traumatize him then.
So well, he said, you know, I don't deserve this, you know, because I don't do these things. But then, you know, this is what happens when you're doing the same thing over and over again. You know, sometimes you have to do something else, I guess. And leave the trauma behind. Yeah. So one of the misconceptions is, or myths, you might say, is that severe psychopathology needs long-term psychotherapy.
Yeah, that makes sense.
Yeah, Fredrike, you were, as far as I know, you were one of the first to write about using solution-focused therapy with trauma and PTSD. And obviously you were finding it effective. So what do you think are the mechanisms of change in using solution-focused therapy with PTSD as opposed to a traditional CBT approach to trauma and PTSD?
Well, the difference is that well, you know, I think traditional CBT, that's why I wrote, I developed my model of positive CBT, which we now research at the university in Maastricht, in the south of Holland, and well, we actually have hills in Holland. Yes, we do have hills.
I thought it was very flat.
We researched my model and compared it.
I have a copy of that one of the articles. Yeah.
I don't have to tell you. Well, it's quite effective, and the good thing is all clients participating in that study preferred positive CBT over traditional CBT.
Yeah.
And not only the clients but also the therapists. They had to get used to it because they were regular CBT therapists who participated in the study. But then, well, you know, traditional CBT, well, let's say hardcore CBT, because you've got the third wave CBT where you've got acceptance and commitment therapy and mindfulness and EMDR, which are all third wave CBTs. But if you talk about first and second wave CBTs, it's about symptom reduction, and that's it. That's about it. And I guess symptom reduction can be very effective, but then, to speak in the words of Martin Seligman, one of the co-founders of the positive psychology, he said our aim was to make miserable people less miserable. And I think that's a very nice quote. Yeah, because this is what we did, making miserable people less miserable. And before solution focus came and before positive psychology came, we didn't even know that there was another side on the coin and how to get people in the pluses. We were only making getting people out of the minuses, and that's what people. Well, let's be honest. That's what many people actually ask when they come to see you. How do I get less depressed? How do I? Talking about an avoidance goal where you want to get away from. And not like approach goal where you want to go to. There's a lot of research on that too. But then I think solution focus, it's different. And I remember Inzu saying at one point, she said, it's not so difficult to learn, but it requires a disciplined mindset to actually to keep on doing it. And so, and sometimes if I ask people, psychotherapists who work with people who've been through trauma, and I say, have you ever heard of post-traumatic growth?
Right.
I really find it appalling that there are still therapists in this world working with trauma survivors who say, no, I don't know what that is. And so I think in my model of PTSD, post-traumatic success, there are 3 R's. It's about recovery. Well, that's symptom reduction, you might say. It's about resilience. All these questions. How did you cope? How did you cope during the traumas? How did you cope afterwards? What did you learn from it? All these kind of questions. How did you survive even? All these kind of questions. And then there's the 3rd R, which I couldn't find the R, so I call it enrichment. Yeah.
Very creative.
This is the post-traumatic growth part, of course, of benefit finding, or whatever you call it. Yeah. Okay.
And you just answered what my next question was going to be. I was going to. By the way, first of all, I got to tell you, as my students watch this, what you are role modeling for them is what I've been saying for years, that it's not just about what you do with clients and students, but it's also very important to understand your model, to really follow your model. And clearly you understand the approaches that you are writing about and practicing.
Hopefully.
And I have that same experience. People, they know post-traumatic stress disorder.
Yeah.
And then they're amazed to find out there's a whole body of literature on post-traumatic growth. And so I like the 3 R's with the E in there as well. What else would you say about how post-traumatic growth works?
Well, fortunately, lately there has been lots of research on post-traumatic growth, and you don't grow from the trauma, but the only way to grow actually is the way you coped with trauma. So trauma is in no way good in itself, of course. So these people might, for instance, say after some time, because it takes a while, of course, say, okay, I didn't know I had the courage to go through all this, or I didn't know I was strong enough to actually survive, or whatever. Or it's about spiritual deepening. Although some people say, okay, I was religious and now I'm not religious anymore. So it might go both ways. There's an Italian cat in the. I hope you don't hear one of my Italian cats. Well, okay. So lots of, well, and I must say I once I wrote an article on post-traumatic success already 2008, and there was this colonel in the Canadian Army, and he said he read this article, and he was a psychologist as well, and he said, okay, from now on, what I want to do in the Army, in the Canadian Army, is I want to install post-traumatic growth groups for veterans. And so I said to him, well, that's very flattering, but maybe you shouldn't call them growth group, because this would mean that everybody needs to grow. You know, and you cannot impose growth on people, because some people will never grow and will never grow from the way they cope with trauma, and that should be okay.
Mm-hmm. Mm-hmm.
So maybe resilience groups would be better. It would be a better option then.
What I'm wondering too, as I'm listening to you, is, you know, I'm aware of dozens and dozens of inventories and assessments and evaluations that help us understand the level and nature of trauma in people. But what about post-traumatic growth inventories and assessments? What's your experience with that?
Well, you've got the PTGI, post-traumatic growth inventory,
right,
by Tedeschi and Calhoun. I think that's the most famous one. There's one for children as well, and these are very validated questionnaires. Yeah.
Excellent. Yeah. So I imagine you know, one of the next steps is to help agencies and schools really use them as they're available more.
Yeah, because I understood, my good friend Lauren Walker, she's a lawyer from Hawaii. She works in a solution-focused way in the prisons in Hawaii. I don't know if you've heard about her. So we work together on solution-focused restorative circles, and she emailed me and she said, well, right now in schools in the States, they have to fill out a long questionnaire, which is more or less very problem focused, about trauma related. And there are no questions about resilience, well, many questions about resilience. And she was very, very much against that questionnaire, which she said is nowadays based, nowadays used in many schools, you know, high schools. Do you know that one?
I don't think so. Laura Walker, you said?
Lauren
Walker, yeah.
Lauren Walker from Hawaii.
Yeah, I have noticed some of this application restorative in social justice and restorative circles, and that has really gained some traction here in the United States, and so I'm pleased to hear that. I'm also aware that, you know, we're just kind of getting started with that.
Sure. Yeah.
I'd like to pick up on what. Oh, go ahead, Nisha. You know? Oh, okay. I would pick up on something Russ said about knowing your theory or theories, and ask you, Fredrike. So you've put positive CBT on the map, combining solution-focused CBT and positive psychology. And in reading your work, it looks like you're really seeing CBT through a solution-focused therapy lens. Is that correct? Am I reading too much into that or misreading it?
No. It's what I do. I try to integrate solution-focused brief therapy and the positive psychology into a CBT framework. So positive CBT also uses the synthesis paradigm. You know, it looks forward at what might be created. So it's about goal formulation. You know, what are your best hopes from this therapy? You know, these kind of questions. And but what we also do is we look at exceptions to the problem. And for instance, what we did in this also in these treatment protocols, which we used at the University of Maastricht, you know, in our research, is the homework task suggestion. We don't say task, we say suggestion, was to keep a diary of better moments. this was a standard homework suggestion. All 8 sessions, people actually filled in a diary of better moments. Well, that's rather solution focused, isn't it? Looking at exceptions within the problem domain, so to speak. So, for instance, another thing, just to give you an idea. Traditional, I don't say negative CBT, I say traditional CBT. That's much nicer, you know. Negative CBT. So traditional CBT or regular CBT or problem-focused CBT uses the downward arrow technique. You know. Right. So what's the worst case scenario? So what's so bad about this? And then what's so bad about this? So I thought, well, I might make the upward arrow technique, which is about the best case scenario. You know, so suppose this would happen, what will be different? And suppose that will happen, what difference will that make? And suppose that will happen, what difference will that make? And then you arrive at the best case scenario. So these are all, let's say, regular CBT terms. Right. Only the focus, of course, is different. The focus is not on the problem, but on the exceptions of the problem.
Yeah.
Right.
You know, related to what you're saying now and what we just talked about with restorative circles and restorative justice, I read a lot of your work, and I know you've done lots of work in the area of dispute resolution. Yeah. And so I wonder if you could just take a minute or two to talk about. So, for example, I'm thinking of a school counselor who's, you know, working with 2 middle school girls in the middle of girl drama. And how would a solution-focused conflict resolution or dispute resolution work?
Well, basically, if somebody is really working in solution focus, where you don't have to know anything about the conflict or about the problem, but in this case about the conflict. But then, well, of course, some people think you need to know. So you might listen just a little while, and as soon as possible, ask questions such as, so I guess you'd like to change all that. Is that correct? You know, starting to ask these goal-focused questions as soon as possible. Then, but then I don't really need to know what the problem is or the conflict is. And some people find that rather strange. You know, I had 8 people sitting at my table. They were living in the same apartment, you know, so they share parts of the apartment like roofs, and so they had lots of arguments. So they came in, all 8, you know, like very upset, and you know, thinking I would give them a lot of space and lots of room to talk about when it all started, who was to blame, whatever. And I said, may I, to start with, I said, may I ask you a rather strange question? And they said, yeah, okay. So I said, could the conflict have been worse? Opening question. And if so, how come it's not worse? And then the first, let's say, the first man, he said, after some thought, he said, yeah, I think it could actually be worse, because we shared the same staircase in the apartment block. So if I hear him coming down from his upper apartment, and I'm just, I just want to leave my apartment, I wait behind my front door until I hear he's gone. If I would do that, and I would meet him somewhere on the stairs, I might actually harm him. So I said, wow, how did you come up with that great idea? Maybe not for the long run, but well, it seems to be very, very, very effective in the short run. And he looked at me, and the others looked at me and said, huh? What strange questions are these? And I said, so, and what else did you do so far? And then he could name other things. And then, and I asked the other 7 persons, I said, well, you hear Mr. One talking about what he did actually so far to prevent the problem or the conflict from getting worse. I'm very curious to know what you have done so far. And then this woman, she said, well, I was in Italy last summer. I was in Italy, and I thought, why don't I buy for all of you a very nice bottle of olive oil? And so she did. And she she gave everybody. So I said, another fine example of all the things you've been doing to prevent the conflict from getting worse. What else? So, in fact, they could all 8 could name things that they done to prevent the conflict from getting worse. And I said, well, I really want to congratulate you, because we all know how easy conflicts get out of hand. You know, one more email and bam, the whole thing explodes. And they were looking at me and they thought, this is a very strange conversation we're having with this lady. So I said, after all the things that you've already been doing to prevent the conflict from getting worse, what might be next signs of progress? And I said, I don't care who does something, or you don't have to do anything as far as I'm concerned. But then, and then, well, 3 months later, everything was okay. One of my shortest mediations, I might say.
Love it. That's brilliant.
Yeah.
And I especially like that you recognize that when you do this kind of thing, you know, it takes students and clients a few minutes to adjust.
Sure.
They think these questions and their approach is so novel and different. It takes them a few minutes to kind of adjust, I guess.
Yeah, but then I started as a mediator, also in a problem-focused way, you know, and you know, I here in Amsterdam, I was chair of the Amsterdam Neighbor Mediation Society, and these conflicts can be very, very, very heavy. In the neighbor conflict. So I started out as a mediator, which is already also a long time ago, by really asking, you know, what's the matter. And then what those neighbors told me, they said, well, we can do this at home as well. We don't need you for this.
Yeah.
You know, we can argue at home. We don't need you for this. We need you for something else. And then I thought, well, if we can do this in psychotherapy, why can't we do this in conflict management, in mediation? So I tried that out as well. And then I thought, well, this is working really nice.
Yeah, and so in some ways, it reminds me of the Roots, which is the marriage and couples and family counseling.
Yeah,
yeah.
Yeah,
Fredrike, you've written several books, really presenting questions. You got one is what, 1,001 questions, and then 3 books, 101 questions for anxiety, depression, trauma. Where do all those questions come from? How have you been able to generate so many good and useful questions?
I've been collecting them. You know, it's you know, I've been very, very disciplined. And you know, whenever I heard a question and I thought I haven't heard this before, I would jot it down. Put it in the computer, you know. So I've been collecting them for quite a long time, and not so often do I hear new questions anymore. But I got about 2,000, I guess.
Yeah.
She's curious about questions like you, Joe.
Yeah. I was God, there's so much gone on in this past conversation. I'm thinking, wow, that's amazing. But there are some clients, I think, what you were saying, Fredrike, that want to start with the problem solution focus, and you said they're obviously people that are not willing to change. And
it might be the case.
Yeah, because I think some people find comfort in that problem, that if I think of the worst case scenario, anything less than that is a gain.
Yeah.
Almost like, if whatever the worst case scenario is, if it doesn't meet that, then at least this is a little bit better than I thought it might be. And it's really interesting where you said with these 7 people is, so could it have been worse, and how have you managed not to do that?
Yeah.
and also about resilience, because I've always said to Aisha, surely people that we see through all the trauma that have been through, that resilience, if we can look at how they've managed to do that and how they've coped or whatever, because the resilience is like the silver bullet. If I can get through this, I can basically get through anything. So how does this approach support in building resilience in clients that feel totally lost, I suppose?
Well, I think resilience is, I don't think you are either resilient or not resilient. I don't think you're either hopeful or not hopeful. I think all these things are more kind of behavior. So I think resilience is behavior. Or can be internal behavior, you know, the way you think, but it's about the same with hope. You know that there's been research being done on high hope people versus low hope people. You know, what do high hope people different from low people who they mark as low hope people? Well, one of the things, for instance, is that it shows in their behavior. For instance, higher hope people, well, I don't like to say things like high hope people, because then it sounds like it's an either or question. You either have high hopes or not. For instance, that people with high hopes, I should say people with high hopes, when they have a long way to go, they will actually divide it into smaller steps, and just start with the first small step. Whereas people with low hope, they will look at the whole stretch and say, "Oh no, this is never going to work for me. This is way too much to do." So yeah, and I think resilience is the same basically. Resilient behavior, and the good news is that you can actually do something about it. You know, if you haven't showed that much resilient behavior, you might find more ways to be resilient, I guess.
Yeah. So as I'm hearing you, I could, what really is the takeaway for me is that where some people believe they can do things because they're resilient, you're saying that it's the other way around. They're resilient because they're doing some things.
Sure. Yeah. Yeah.
And you know, for people who continue focusing on problems from whatever reason, one of the things that I'm fascinated by, you write about it here and there, is this idea of externalizing the problem. Maybe you could describe that just for a little bit.
Yeah. That's not really solution focused. That's from narrative therapy. And it's about externalizing the problem is, you take away the blame from people, because you might say, please describe me in one word what it is that you're suffering from. For instance, people might say depression, or anxiety, or trauma, whatever, you know. And then you can look at people and you might say, okay, so on a scale, using scaling questions, 10 meaning that you've got every control over depression, and 0 meaning depression has every control over you. Where would you say you're at the moment? And so people might say a 3, for instance, indicating that depression has more control over them than the other way around. And then you might say, okay, so, well, a very solution-focused question at that point would be, I'm sure you know, what's in that 3? How come it's not lower? How come it's not a 2 or a 1? Because then there's already a little, well, it's a little underway. And then you might say, okay, so where would you like it to be in the future, in your preferred future? And people might say, well, maybe the 10 is not realistic, but let's say a 7 or 8. And then you might ask them to describe their life at the 7 or the 8, of course. And then you might start from there. And it's a nice way, by naming the depression or anorexia, or, well, you know, it can be any name, things what people are suffering from. It's a very nice way. You can do it with families as well, of course, because the mother can give a mark, and the father can give a mark, and the brothers and sisters everybody can give a mark, and it's a nice way to work with families as well, because it takes the blame away from parents as well.
Nice, yeah, that's wonderful.
And what's really nice, Fredrike, is if there's one of the family members who's so much higher, it's like, so what are you noticing that maybe everyone else isn't? And that's a lovely conversation as well.
That's very nice, because sure, people will give different marks, and that's very interesting, because my experience is that mothers usually are the lowest, and fathers are slightly higher, and children even higher. But then, well, that's okay. It's very subjective, and that doesn't matter. So even if a mother says, I think it's at a 1, my question will still be,
right?
Why is it not? Yeah.
How come it's not lower than the 1? And if people say, well, I'm at an absolute 0. Well, well, it's not nice, of course, that you have to say that. So you have to acknowledge the fact that must be very hard for people to say that at the 0. But then I might say, so how come you're not at -10? Yeah. And I once had somebody said, if I had known that I could scale down to -10, and I say, yeah, but you didn't.
Missed opportunity.
Oh my gosh.
Yeah.
You obviously have so much experience. I always am interested in success stories. I wonder, what is one of yours? What is a really difficult case that really you were able to help using the solution-focused approach?
Oh, that's a nice question. I remember one mediation, a divorce case, because I've been a mediator for the court in Amsterdam for many years. So I got these divorce cases of people who had been fighting in court for many years, and well, this couple was one of those couples, and had been in court for many years. And well, basically, they tried to do the same thing at my table. And so at one point, I thought, well, I must do something else. So I asked a very solution-focused question, and the solution, they had 2 children. One was, I don't know exactly, but let's say 6 and 8 years old. So the question was, suppose I meet your children in 10 years' time. And suppose we came to talk about the current situation. What would you like your children to tell me on how you handle this situation in a positive, in a good way?
Wow.
And then the mother started to cry.
Yeah.
Because she said, now I realize that if I want my children in 10 years' time to tell me how we handle this in a good way, I now realize that from now on we have to do things differently. And that's what they did.
That is wonderful. It also strikes me as a great way for us to help school counselors work with parents, especially during a divorce situation, as part of the parent conference.
Absolutely. Yeah.
Wow. That's wonderful.
Fredrike, I know you also did some work and published some on working with clients and their families who have intellectual disabilities.
Yeah. How do you know?
I have your publications.
Oh wow!
So I'm now a retired professor of Ohio State University, so I have access to this wonderful library. Yeah. So could you tell us a little bit about how you got into that and your experiences with that?
Well, I got into that because I had a supervisee who was working in that area, and he was a CBT. Was in a CBT supervision, and he wrote a very nice. Well, you have to write some kind of case to become a member of the CBT association. He wrote a very nice case on how to organize a dinner, and he made a little booklet together with his clients on how to organize a dinner, which might be quite a challenge for people. So later on, he got his PhD, and probably you wrote one of those articles working with people with intellectual disabilities, or if they were the disabilities were too severe, working with the teams around those people and the parents around those people. Yeah, so I think there's one beautiful example from his from the place where he used to live. There was this young guy, and he had quite a severe intellectual disability, and they asked him, and I think that's a very brave question. They said, "What's your dream?" And then he said, "I want to become a pilot on an airplane." And at that point, you might take different routes in how you handle that, because you might say, "I don't think that's possible." That's not what they said. They said, "Okay, let's see how far you get. Let's see how far you can come." And the good news is that now he's working on Schiphol Airport in Amsterdam. He's working in an airplane, and he's actually gluing toilets in the airplane, and he's totally happy.
Oh, wow! What a great story!
Wow, that is
nice.
Yeah.
Beautiful.
So how are we to know how far somebody can come? You know, we cannot judge that. We cannot see in advance how far. Some people might go much farther than we think, and some people maybe not. But then that's not up to us, I guess.
Yeah, that's a great reminder for all of our clients and students that if we're doing, for example, solution-focused scaling, you know, if they pick a number that's too high, that we believe that they overdid it, that instead of challenging it, we explore it.
Yeah, sure.
Yeah.
How do we know? How can we know?
Love it.
Yeah.
I just realised I'm not on mute, and I'm going. Sorry, guys.
No, but it's a beautiful viewpoint. Let's see how far we can go with it.
Yeah.
Let's not dismiss it out of hand, but let's see how far we can go.
Yeah.
Fantastic.
Who knows? Yeah.
Yeah.
I wonder, Fredrike, if there's we've been asking you lots of questions and learning a lot from you, and I wonder if there's some questions we haven't asked you that in the time we have left, something you think we should know. And know about your work.
That's a nice question. Well, you know, talking about Milton Erickson again, you know, the guy, the hypnotist, psychiatrist from the 70s. You know, what I would like to see is a quick change in psychotherapy, in law, in education, and that's just not going to happen. And I remember there's this metaphor by Milton Erickson, and he says there are two ways to change the way the river flows. A river flows, and he said one way is to actually build a dam in the middle of the river, and probably the river will be too strong for the dam, and the dam will be washed away. And he said the other way is to take a stone every day, or maybe 2 stones every day, and put them in the bend of the river where you want the river to take another route, so to speak. And I think this metaphor by Milton Erickson is keeps me patient. And it keeps me patient, and that's and I think when I do training courses or write up another book or another article, whatever, I look upon them as stones that I put on the side of the river where I want the river to change. And luckily, because I've been doing this for quite a few years, slowly, and it would be great if things would go faster. But the whole world is very problem focused, so we don't change that overnight. So this metaphor keeps me patient enough to go on with what I'm doing.
I really love that. That really resonates with me.
Yeah.
Doing all of this in a problem-centered world, I get it.
Yeah,
Wow.
sure. Yeah.
Can you teach Aisha some patience?
I'm sure she's patient. She knows how to do it.
Oh,
Yeah,
Oh.
I was.
Joe, what would you notice her doing if she were more patient?
Been trying for 15 years.
Oh wow! Yeah.
I was going
Could you share some pointers with us about? You're obviously a very productive writer. Share some pointers with us on what works for you in doing that.
In writing, I love it.
You just put in the time. You just do it.
Sure. I put in the time. Sometimes when I look at my schedule, which is quite busy, I block 1 week, for instance, and this is my writing time. I can write an article or a small piece in a weekend, but really writing a book is something different. So I'm very disciplined then, so I go and sit in the morning. My husband brings me a cappuccino, and I write all day, and I love it. It's the flow thing. When my kids still living at home, they would come from school in the afternoon and would say, "Okay, what's for dinner?" And I would say, "I didn't even have lunch yet," because I was away writing. So I really like writing, but also because I have a mission. Because I really think that things can be shorter, more effective, lighter, and more fun. I once read an article that if you do psychotherapy, that if you can laugh with your clients in the first 5 minutes, you have a better result.
I agree.
I was gonna ask you about that, Fredrike, because you've said it should be easier, shorter, and more fun. How do you inject fun into what might be a very difficult, problem-focused situation? How does that help the process?
I think basically my job is to ensure that there will be positive emotions in the room. By asking about what people do want, by asking about their preferred future, by complimenting them, by asking exceptions, by posing competence questions. How did you do that? How did you decide to do that? All these kind of questions. So because if you look at the positive psychology and all the research that has been done in the positive psychology world on positive emotions, basically it does 4 things. It enhances creativity, flexibility, empathy, and resilience. So I think that's my job. To get positive emotions in the room. So even when people might come in and their mouths might be like this, when they walk out of my room, I want their mouths to be like this.
Yeah.
Sorry. Go on.
Yeah.
I completely agree. And when I deliver the workshops for parents and domestic abuse survivors, I spend at least 20 to 30% of that time making them laugh and having something in common to laugh about. And because I think they need to lighten up. It's not always about the problem. And because we do a lot of work on focusing on finding themselves. So taking the hat off as the survivor or as a parent or as an employee, but who are they? And we just start having a good laugh about that. And I tell some funny stories, and guess what happened to me with my 12-year-old stories? I say that all the time. And sometimes my 12-year-old hears me and she's like, I never did that. I'm like, shh, you did now. But it is about finding that connection and making them laugh, because then they're more likely to come back because they feel lighter.
Sure. Yeah, I totally agree. Yeah. And then there's been research done about actually, if you start the conversation, let's say, with a plus, and in the middle it might be some problem talk, and you end with a plus, the resource activations versus problem activation, call it on the internet, it makes you a more effective therapist if you do it like that. So you start with
I'm an effective therapist now.
Yeah.
I'm going to write that down. I'm going to write that down somewhere. Maybe, Fredrike, you can join one of my workshops, and then you can tell me if I am or not. It'd be quite fun. But Fredrike, am I doing it right?
Fredrike, is your website a good source for trainings that you do? If we wanted to find one of your trainings and attend one of your trainings, would it be on your website?
My trainings are on my website. Now, not all my trainings are. I do lots of in-company trainings, and they are not on my website.
Yeah.
And in Holland, my trainings are in Dutch, so I guess not much. But then I do travel. Well, I used to travel the world, and hopefully this will happen again. So then you can take a look at my website, because then like congresses or I did training courses for the Illinois counselors. And everything is in the webinar form nowadays, of course.
Right. Yes.
And also with India and Iran and whatever. So Indonesia, I used to teach at the University of Bandung in Indonesia. Well, all these things came to a standstill, of course. But then who knows?
Well, Fredrike, if you need a companion, if you need someone to go with you, so just I can make myself carry your luggage, make your coffee, tea, hold the lots of the tens and hundreds soon, probably books that you will be writing. I'll be there.
Okay.
I think I'll have to fight Russ, but
yes. I might be able to carry more. I don't know.
Could I ask you, Fredrike? Obviously, you're passionate about your work and committed, and it's. If you weren't doing this, is there something else that you would have liked to have done if you weren't in this field? Because I've often thought myself, what would I be doing now if I wasn't doing this?
Yeah, that's a nice question. Well, one of my best friends, she lives in London, and she got hooked to an English guy. Yeah, that happens. And so he had shops in London and vintage clothing, and also she was on how's that market called? In the
Camden.
Yeah, she had shops in Camden as well, and in Covent Garden, and also in the big market, the open air market.
Portobello Road.
Portobello Road. Yeah. Okay.
Yeah.
So yeah. So why am I telling this story now?
What would you be doing if you weren't doing?
Yeah. So I used to go to London quite often, and at one point I thought, well, maybe this was around the time that just before I discovered Solution Focus, that I thought, why don't I become an antiques dealer? Because I love, I see salvage hunters on TV. This kind of thing. So I thought, I tried it out for a short time, and I didn't find it so much fun. So I thought I'd rather might do it as a hobby. But what I really would like to do is architecture.
Ah, wow,
nice.
But then the second best of being architecture is to help people to design an outcome. And so I am a designer in that sense, and so maybe I'm not an architect, but I'm sort of designer anyway.
I like that.
Absolutely.
Yeah, my house needs some help.
We have, unfortunately, guys, come to the end of FBS Chat so quickly. But if I can take last words, last comments from all of you, and then I will close.
Well, I just have to say, I'm just feeling privileged and delighted here. I would love to continue. and I'm motivated to go back and read some more. And you've got me thinking about the world being more solution focused. And wouldn't it be nice if our politicians could be more solution focused?
Yeah, I was doing an interview lately and with a Dutch newspaper, and they said, so what is a field you would like to you would still like to make a difference in? And then I said politics. Oh yeah, politics. Yeah, a lot to be gained over there.
Definitely.
I've seen strength-based approaches writ large being used at organizational change levels, and to some extent community change levels.
Yeah.
Solution focused, narrative, also appreciative inquiry.
Yeah.
So it's just getting our politicians to be that way, to embrace that, internalize it.
Yeah, and then I think of the metaphor of Milton Erickson again.
Yes. Everything nowadays that we're talking about can trace its roots back to Erickson, I believe. Milton Erickson.
Yeah, and Bateson. Yeah, sure.
Yeah. I would just say I'll just echo what Russ was saying. What a treat this has been to get to know you, to meet you, and to ask you questions, and
thank you for your question.
To spend some time with you. It's been a real joy. Enjoy it.
Real pleasure. Thank you.
It's been lovely observing this conversation, just watching you guys and listening to what you have to say, and yeah, absolutely energized. There was a quote I think that you put on one of your websites, or from Carl Jung, about I am not what happened to me, I am what I choose to become.
Yeah, sure.
And I thought this is kind of everything we've spoken about, kind of encapsulates that. It's not what's happened to me, what I choose to become. So, and it's been absolute pleasure, guys. It's been amazing. Thank you so much for your time. It's absolutely.
Oh, you're welcome. You're welcome. Okay.
And I would also like to thank you. Thank you for responding to my emails. Thank you for being here. Thank you for making a difference to the four of us and to everyone that's been watching. We have had a lot of questions, but it was answered, so I didn't have to put any up. I'm totally inspired. I feel like I need to follow you around wherever you go so I can learn. And I feel so inspired to just keep learning. And to do right by our clients. So I kind of know I'm on the right track when you were talking about humor. So yeah, that was very useful amongst a lot of other conversations that we've had tonight, or you guys have had, and I've just sat here. But yeah, thank you so much. Any last words from you, Fredrike, before I close?
Oh, any last words? Well, I thank you for your questions, and I thank you for inviting me. And well, whenever I'm in the neighborhood, I'll come and find you.
Yes.
Yeah. Yes, please.
I may not let you go. That's the problem. But yeah, do come. Yeah. That would be amazing. Thank you so much. Can I just ask you guys to wait there for a couple of minutes while I close, just so we can have a quick private chat afterwards, just to say thank you privately. And to everyone else, next week, Wednesday, we have William Reed on FBS Chat, who's, I think, the youngest solution-focused practitioner ever, and who works alongside Tara Gretton. So they will be joining us next week to talk about an experience as a young man who was receiving solution-focused therapy and now is on his path and his new journey to becoming a therapist himself. So thank you very much, and I'll see you guys next week.
Okay.